Good afternoon. I'm Laura Shumaker, and I'm an associate degree RN student at Hocking College. This is my somewhat reluctant volunteer, Ryan. I'm here today to discuss with you some first aid techniques and demonstrate them. More specifically, we will discuss head injury and how to splint a broken arm. The information we will cover today will include how to protect the area and what to watch for. So let's get started. Head injury. A head injury is any trauma that can happen to the scalp, the skull, or the brain. These injuries can range from anything from minor bumps to major brain injury. For this speech, we're just going to focus on minor head injuries. Minor head injuries are usually not a serious problem and can be caused by getting hit in the head, falling and bumping your head, motor vehicle accidents, or sports injuries. Right after the injury occurs, you may feel dazed, dizzy, lightheaded, you may have a loss of balance, you could be nauseous, you can have a headache. These are common symptoms and they should go away within a couple hours. At the point that you're going to want to seek medical attention, it comes when your symptoms become worse, your person becomes unusually drowsy, they may be harder than normal to wake up, or if they would to be developing a headache in the back of their head. If the head is bleeding, you will want to stop the bleeding. Now with it, if there's an open area on the head or a laceration, you don't want to wash it. You don't want to put any germs or bacteria in there where you could make it actually worse, put them at a greater risk of infection. So we're going to look at stopping the bleeding. You can use a clean cloth, a washcloth, a gauze pad, whatever you have available that's clean. You're going to want to apply that directly to the area that's bleeding. And you're going to want to hold some good pressure to that. You'll hold pressure. Once you get the pressure held on for a few minutes, then you're going to go ahead and want to secure that with a gauze dressing. When you're wrapping this, you want to wrap it tight because you want that to add pressure to help stop the bleeding. While you're wrapping it, you want to pay close attention to them and take this opportunity to talk to them and make sure that there's not any changes in their level of consciousness and make sure that they're still alert with you. You can just ask them some basic questions, make sure that they realize where they're at and what's going on. As you're wrapping it, while you're waiting for medical personnel to arrive, if you would notice that the bandage is starting to get bloody, you don't want to remove that dressing. You want to just reinforce the dressing by placing another one over top of that dressing. That'll help stop the bleeding. It'll help put a little extra barrier there. When medical personnel arrives, you're going to want to let them know a few things. You're going to want to let them know what happened, when it happened, and what complaints they had, and if they lost consciousness. Now we're going to talk about broken arms and how to splint them. Broken arms always require medical attention. Whether it's a minor fracture or a major broken arm, it always requires medical attention. Broken arms can be defined in two different types. You can have an open broken arm, or you can have a closed broken arm. Open broken arms is where the bone actually protrudes through the skin. If you were to find that, you don't want to try to push the bone back into the skin. All you're going to do is you're going to take a cool, moist cloth and you're going to apply that directly over the broken bone. Gently lay it there, and you're going to want to splint the arm in the shape that the bone is in. Never try to realign those bones. We're going to look at closed fractures, which means the bone hasn't broken through the skin. You can tell that there's a deformity in the arm is probably broken. That's what we're facing. We're going to say that his break is right here in the arm, and we're going to protect that. You're going to want to get something firm Magazine will work, a piece of cardboard, cereal box, anything that's going to hold to the shape that you put it in. And when you put the splint on, you want to put it so that the splint covers the area directly above and below the brake so that it supports it. And as I said, you're not going to want to try to realign the bones or anything. You're just going to splint it in the shape that the bones are in. And you're going to secure your splint. You can use anything you have laying around, string, ribbon, rope, gauze. You can even tape it. Once you get your splint secured, you're going to have them lay their splint against their chest, and preferably above the heart level. This is going to help with swelling. Then you're going to want to take an ice pack and you're going to put ice on it. When you do ice, you always want to make sure that you wrap your ice in a towel. That's going to protect the skin. We're going to apply ice because that's going to help relieve swelling and it's going to help relieve pain. And you're going to do this until medical help arrives. So in closing, while some injuries can be prevented, many can't be. Accidents are a part of daily life and they're going to happen. The important thing to remember is stay calm and relax. Does anybody have any questions?